Welcome to On the Pulse, our new podcast hosted by Hoop Nursing, part of the Hoop Recruitment family. We have been hosting a series of episodes, each looking at different perspectives within healthcare, hearing directly from health professionals working in the field. I'm over the moon to welcome back Jenny Williams, who kindly gave us insight in our second episode, detailing a typical shift in a CAMHS unit. Jen is back with me today to reflect on the series and explore the seeming trend across any area within healthcare that is preserving the wellbeing of our workforce and those that work within healthcare. Thank you so much for coming back, Jen. Really, really appreciate it. I think after the episode we did about the CAMHS unit, I think it's clear to say you and I can just talk and time will just run away from us. But honestly, thank you so much. I think that was really, really insightful. And looking at the rest of the episodes we've done, there's clearly a common theme here that it's no matter where you go within nursing, you are going to have days where it is really challenging emotionally, but it can affect your mental health. This I think any workplace could, but I think it's being mindful that within this area, in healthcare, no matter which area and sector you take or choose, you are going to be exposed to some form of traumatic experiences, emotional distress. And I'd like us to today have a real, delve into the world of resilience and well-being and how we can help our workforce out there, how we can help, from my point of view, how we can help the agency nurses and my nurses that go out and my support workers that go out into these environments where they are going to be faced with challenges. And I suppose just to have a big discussion, because it's a huge topic.
Thank you so much for having me and for all your kind feedback as well from the training that you've had so far.
Honestly,
been really good.
Absolutely deserved as well, Jen. Having sat in it myself, it's fantastic.
Yeah, and it's really encouraging for me as a mental health nurse and as an agency nurse as well to see that there are agencies that are willing to have these conversations, because there is so much stress and pressure in these unprecedented times when the environments were already stressful and pressured before we had the pandemic, before we had the depleted numbers of staff. So it's only building more and more at the moment.
Absolutely.
So to have workplaces that are thinking about how we can ease the stress and how we can support staff, I think is absolutely essential for retention and for recruitment as well. Before getting into healthcare, I used to teach judo. And then since being in healthcare, that's transferred to me taking people under my wing and giving them as much support and encouragement as possible. So I decided to go back to university and get a postgraduate certificate in education. And from that, I decided that I'd open my own little business. So it's a very small venture, but it's my way of leaving a legacy as a professional. The more people that I can teach, the more confident I'm going to be in retiring when the time comes, knowing that I've done everything that I can to not only take care of my patients, but to pass my skills on to people who are up and coming as well.
Well, I think we touched on that, didn't we, actually, in the episode we discussed about the CAMHS, service. It was your passion about looking after and mentoring and educating students or newly qualified nurses, that shone through there. So obviously that then has transpired to, I suppose, the birth of Headucate.
Yeah, definitely. So I teach all things mental health to anyone who wants to listen. So over time I have developed more and more courses that I can offer. And I enjoy bespoking those courses to my clients' needs as well. And that then translates as those people not only getting the knowledge and the skills that they need, but the right attitudes as well. Being able to understand what their preconceptions are and what their opinions are on things, and being able to help them with their mindset and help them to understand how they can apply their newfound skills and knowledge specifically in their area of work. So I do mental health first aid for complete lay people and can offer that at 3 different levels as well.
Wow.
I do mental health first aid for young people as well, so people specifically who need to support the needs of young people, because that looks a little bit different. And then I do specialties for health and social care professionals as well. So I cover some of the specialties that I've encountered in my diverse career, such as personality disorders, eating disorders, depression, anxiety. Anxiety really is the cornerstone of mental health. So it's not often that some sort of anxiety management doesn't crop up in what I teach. And then I've been doing a lot of resilience work as well.
Honestly, that training course that I attended, it was only, a couple of months ago now, I think, wasn't it? But there were tears across the board, and I think that was really, it just eye-opening, pardon the pun, that sounds to my eyes, but in all seriousness, not to dilute that, it was really, we all have challenges, or it may not be right now, but we've had them, and like I mentioned in the previous episodes, we can sweep that under the carpet. That's only good for so long until that little lump becomes a mountain that you then have to stumble across. And then that is when you have maybe a breakdown, you just have this crescendo of emotion and you just can't cope. Or your anxiety gets the better of you, or, because I think we all have a level of anxiety in us, don't we? How does that look? And sometimes our resilience, so this is where the resilience kicks in. It's so for us as an agency, I'm going to talk from that perspective, we want to ensure that we're contributing to the resilience building of our staff, because it's really crucial that we support them with that body armour, if you will, or like a metaphor. Yeah. It's that we want to give them armour to be able to digest, reflect, review, and we move forward. And it's having that mentality.
Yeah, absolutely. And it's so important to have those sessions as collaborative workshops where I can bring some theory and some suggestions, but also bring those learners on that journey with me so that they are individually benefiting from it, rather than it just being a bit of theory that may bear no relevance to them. It's bridging that gap to make sure that we understand how we apply that theory to their specific situation.
That is the nail on the head, I think, as well, Jen. That's what you did in that session. You had different disciplines in that room, and everybody was able to relate, because, I think the other thing is not to have too large a group. And I know, you've got a maximum limit, and I understand why completely, because again, honestly, you were engaging people. We all felt heard. We all felt that you were able to, and you genuinely were, demonstrating that sincerity of, I'm listening, I'm here to listen. So on wellbeing is a huge umbrella term as far as I'm concerned. It's a buzz thing at the moment. If I'm going to be honest, again, if you look at all the, so I guess go to social media, but it's not. It's really key. It is such a key part of our existence. But it has been diluted, I think, a little bit by, I said that word a lot, haven't I? But, it has been, and I think by other things, and, it's the buzz term, but it's not. It's something that should be integrated into any business setup, is the well-being of your staff.
Yeah, absolutely. And it's something that we overlook as health and social care professionals. Definitely, I can speak for nurses, because we are trained with the expectation that we serve others, we put other people first, and by nature that is what we're happy to do. But of course our careers are not sprints, they are marathons, and things
that is a good way to put it, absolutely.
Things will take a toll if we're not really careful. So it's so important that we commit to looking after ourselves, and for some people that's really uncomfortable because it's not in their nature to prioritise themselves. They will perceive and they will tell me that they don't have time, and I will come back and say that perhaps they're not making time. And for the people who are really uncomfortable with making that time for themselves, I like to point out that if it's not for yourself, then you need to do it for the people that you're serving, because you need to be the best version of yourself to be able to deliver a consistently high level of care to them.
I agree, and I think I don't know if you mentioned this off kind of mic or whatever the terminology is for these things, but the oxygen mask. isn't it? It's, you're on a plane, your oxygen mask come down. If you don't put yours on, you may be able to get 2 or 3 people with their oxygen. If you put yours on, you can then deliver more and you're going to save more lives. Because if we're not looking after ourselves, and I'm saying that with such a hypocrisy tone to my voice, because I'm the biggest hypocrite, I don't do it, and it is important. And I think there is also to take stock. It's not selfish to have 5 minutes for yourself. And I think there is that, we're in this world where, it has been, the more hours you put in and, the better you look, or, whether that's in, in the school, if you're more visible in the playground, or, you get labelled very quickly these days, which wherever you kind of go in life. But actually you need to take 5 minutes and kind of just take a breath. And whether that is 5 minutes of what that actually transpires to be a 3-hour training session, but absolutely they're given the tools for how to manage that well-being. And I think it could be training, it could be go for a walk. It doesn't have to be something. I think it's just, we're very quick, aren't we? Just to say, oh, as you say, I haven't got time for that. I'll get back to that bit. And actually your well-being falls right to that bottom of that list.
Yeah, every time.
We're so accessible. We are too accessible. If I often say to my kids, or even to my partner, I want to go and sit on a mountain where no one can get me, with sheep, because I can just sit there and nobody, and on my own. So not pen a van, because that's always rammed with people. I don't want to see anybody. I don't want to talk. I just want to sit. Do I do that? No.
Yeah, I really relate to that. I remember being a registered manager and not only having my working hours, but being on call as well. And I used to weigh up whether I could go swimming when I was on call. And, you just start questioning whether you can live your life when you're off work because you're on call.
Yeah.
But I did get that feeling when I did rationalise it and I went swimming. It was a pure break because nobody could get me in the pool.
Yes, honestly, I get. And do you know what? I think swimming in particular, isn't it? And when you go into water, no one can even you can't even hear anyone.
Yes.
It's lovely.
Maybe that's why I'm not a registered manager anymore as well. Hiding in the swimming pool.
But that is it, though, isn't it? We tend to just, and it's the guilt, though, as you say there.
Yeah.
You feel guilty for giving yourself 45 minutes.
Yes, what if someone needs me?
Yeah.
What if something happens?
I mean, a colleague here at Hoop actually said to me that somebody said to her, it's like we all impart these little pearls of wisdom. Somebody actually said to her, we are really insignificant.
Yes. Yeah, we are.
And do you know what? That was the most liberating thing I've heard.
It's really powerful.
It is.
Yeah.
We are really insignificant because we've all created these lives, this busy, and again, I'm speaking guilty here as charged, and she's right. And she said that to me, and we are, yet we've made ourselves this level of stress. But I think society expectations are going up and up and up, aren't they? And that's forcing us to have higher expectations of ourselves. And then this is where, if we're going to do that, okay, I suppose the society is pushing us, but we have to say, do you know what? If you're going to do that, we want these pillars and foundations in place to be able to support us to do it.
Yes.
You cannot expect us to function. It's the same thing, isn't it? About medicine and things like that. And, caveman only lived till the age of 30. Well, yes, because they didn't have access to the medicine we have, but they also didn't have these stresses. They're different stresses. Animals would eat them. It's so different. It's just, we evolve. We can't compare. You can't go back to our parents' ages, and generations and compare. They went through a world war. We've been through a pandemic. There's so many different things, but you can't discount anyone's stresses. It's relative to that time. It's relative to that person, whether they've got children or not, whether they've got a job or not. It doesn't matter. People have their own levels of resilience, of their, I think, what their predisposed levels of anxiety they can cope with, and actually there's their network around them. If they haven't got a support network as well, then they're at further disadvantage. So I think well-being is huge, isn't it? And gosh, I could talk about this for hours and hours and hours.
No, I can the same, and talking about those that evolution and looking back to the cavemen days, like puts me in mind of a theorist that described stress in by looking at antelopes in the Sahara, and they're being hunted, and so sometimes when an antelope's being hunted and they can't get away fast enough, they have to play dead. And so they play dead so that they're less interesting to their prey. Perhaps the prey can't see them as well. All of their blood will rush from their extremities to their main organs, so their limbs won't smell as fresh to that predator.
Wow.
And eventually that predator will lose interest, walk away, and at that point that antelope is safe. They stand up, they have a big shake, they shake all of that stress out, and then they're free to roam again. And
oh my goodness.
what that theorist is saying is, with the complexity of our lives nowadays, we have lost that ability to shake it off. And that was true for me when I look back at those days of being a registered manager. There was no opportunity from being at work or being on call to shake it off. And I think even now, like for us as working mums, we're needed at work, we're needed at home, we're needed at work, we're needed at home. When do we get that opportunity? When do we make that opportunity to shake it off? The other example, I had the pleasure of teaching resilience to a group of teenagers at a youth centre recently. And so I bought them all a bottle of drink. And I challenged them to take the lid off of their bottle and to hold it straight out in front of them. And the one that held it for the longest got a prize. So they had some incentive. And then we were able to talk as their arms dropped. We were able to talk about what the point of the exercise was. And I was making the point that the drink in the bottles represents their stress levels. And being under stress, you can hold that bottle for a minute and it'll be okay, but pretty quickly you're going to feel the effects of that stress. You're going to feel the weight of it. And so we need to find ways of putting that stress down rather than carrying it around with us all of the time. And that led to a really fruitful discussion then around how that's going to look different for everyone, and so different coping strategies and what helps them distract from that stress. And a lot of the examples coming out were examples of mindfulness, examples of how these young people are in the moment. And the value of that is that when they're in the moment, they're not freaking out about the future, worrying about their exams. They're not dwelling on the past and the things that have happened. They are appreciating now for now. And that's really valuable.
I think that's, again, it's just having that insight, Jen, into even just those, how you relate to that group is obviously different groups, you support here at Hoop. And I just think that's really interesting. Again, thinking about how you're educated, if we get there earlier and get their education in earlier, they'll grow up with the tools rather than wait for crisis and then we strike, Yeah. So just to bring it back to the episodes, I suppose, because I think you and I could talk about wellbeing for years, never mind hours. But just because it's such a huge topic, isn't it? And I think there's so many different opinions out there, but also theorists, as you've mentioned. And I think that's where I'm a bit useless on that front. Apart from good old Maslow, I'm a little bit useless. And Roper, Tierney and Logan. But anyway, we were not going to cite Rhian's lack of theorist knowledge. But anyway, point is, I think you and I could talk about this for days, because I think it's a passion of both of ours, isn't it? I think that's maybe where you and I do get on so famously, is because you want to educate people to give them the tools to be able to manage themselves and their well-being better and enhance it. And I think I want the same.
Yeah, we have to talk about it now more than ever.
Absolutely. So for people listening now, it's, I suppose, practical things they could do. So what we could look at maybe is just maybe discuss a few little tips maybe you've got to enhance their well-being. And then maybe we have a little look maybe for some employers out there that may be thinking, okay, I'm listening, what could I do? So what can I do as an employer to support my staff and their well-being? So if we look maybe first at what would be 3 tips for a bit of self-care in terms of managing your well-being.
Self-care, okay, so as a nurse, let's nail these basics. Let's think about how you can get a good sleep pattern, eat healthily, think about what you're putting in your body, keep those hydration levels up. That is so significant, and those basics are so easy to miss on a shift. think about how you're meeting those basic needs. I know you love a bit of Maslow, Rhian.
I do. I love a bit of Maslow. I love him. Because it's true, isn't it? If we aren't hydrated, our brains won't function properly, and that's physiological, that's science, you know, that's the reality. Although I'm listening, because I completely agree with you. And I think, how many times do I do those things every day? Not very often.
No.
So if we don't keep it basic, and it's, I've read something somewhere, it's 21 days, isn't it, to form a habit. It's 21 days.
Yeah.
So on that notion, it's setting yourself up as well. And you can't change the world, and not even change the world, change your world in 21 days. You're not going to change the whole, oh look, I'm this person I wanted to be, because you're never going to get to that person anyway. So you're going to just keep evolving and developing. But in my head, if just add one of those things on, so hydration, key, absolutely paramount. So it's just every day now for 21 days, target yourself, and then that will become a habit. And then the next 21 days, maybe add something else on and pile that up slowly and build on it, rather than think, oh God, I need to do all of those things. I can't do one of them. It's that, I think, isn't it, bite size as well, and adding that stress on you of, oh God, I've got to do that now. It's something else to the to-do list. So I think that's really, but you are absolutely right that those are the core things that we need to function optimum levels, isn't it?
Yeah. And I think really tuning into the thoughts and the feelings that you're having, giving yourself time to feel those feelings, because we're human.
Mm-hmm.
It's absolutely normal to have different feelings depending on what's going on around us. And I think to really be able to reframe those thoughts is a huge skill as well. So if you're having negative thoughts about your workplace or your performance or maybe mistakes or poor outcomes, you need to challenge yourself to think about how you can frame that in a more compassionate way. Rather than, I'm a terrible nurse because I've done this, it should become, next time I'm going to do this. And you move forward and you develop and you accept.
And I'll be better because of this.
Yes.
Rather than, I'm useless because I did this.
It's such a powerful reframe.
And they do say, don't they, you should speak to yourself as you would speak to a friend, and we don't do that either.
No.
We tend to speak to each other, God, you look hideous today. Oh, look at your wrinkles. Look at those pores. What are you wearing today? Look at your hair. You'd never speak to anybody like that, would you? We wouldn't. That's so rude. So why do we do it to ourselves? I do it. And you think, we are our harshest critics, and that has to stop. It does, doesn't it? But again, 21 days, that would add to the habit list. But yes. No, but, that is really, that is really fundamental as well, isn't it? What you're saying there. Have you got any other tips then that you would say?
Yeah, so I'm trying to pick my favourite.
And I keep on.
But I think to really check the facts, take that thought to court. Would what you're thinking stand up in a court of law? Is there evidence to support it? Because sometimes we have thoughts and feelings and anxieties, and we will feel stress and anxiety due to a perception of the situation we're in, a perception that we cannot meet the demands that's being placed upon us. But is it true that we can't do it? It might be that when we stop and take a minute and step back, we realise that, all right, we've been under these pressures before and actually we did quite well. I think we just do it again. There might be some solutions there. There might be some ways that we can break down the situation. It might be that things are changing and we need to accept these big changes, but there may be things that aren't changing that we can anchor ourselves to. So it's about really digging deep and finding the positives. And I don't say that as someone who's able to do that all the time. Just because I teach resilience doesn't mean that I'm perfectly resilient. It's something that I'm working on.
I think you keep working at it, though. I
and
don't think
that's
you ever
the
get to that
beauty
level,
of
do you, of, equilibrium where you're there. I don't think that exists. And I think, as you say, you just keep working on it.
Yeah, and that's the beauty of it. Resilience is something that we can build. So the more disciplined we are, the more we're working on it, the better our resilience is going to get.
Absolutely.
Whoever you are, whatever you've been through.
And wherever you work, it doesn't have to be healthcare. It could be anywhere. No. In any, whether that's your personal life, you're, studying, if you're, for any course, if you're a GCSE student, it doesn't matter, does it? It's, you could apply it to everything.
Yeah.
And I think it's actually a life skill rather than something that's associated with the working environment, if that makes sense. So thank you so much. I think honestly, I'm taking things from that, and I know that some of that is discussed in depth then in the training course, in the your resilience course. So as an employer, then actually, that probably bridges nicely into that.
Mhm.
So for any employers out there, so anyone's listening to this podcast and they've got a workforce that maybe are feeling a little bit deflated and they don't actually know what to do, what would you, and they've got, maybe there's a wellbeing thing for HR which is centralized somewhere, completely unreasonable that they can't access, and don't get me wrong, there is apps, and please don't think that I am again discounting anything in terms of, if there is a hub, or I understand that they have their place, absolutely, but if somebody wants to make, and they are really important as well, please, I'm very mindful, it's such a sensitive topic, I would never want to to discount anything, or even I suppose be disrespectful about anything that exists, and that employers have. But how can they make that? What bespoke ideas, I suppose, what could they do to help their workforce? Not necessarily if somebody's struggling in particular, but just as, they're sat there listening to this thinking, right, these are all great ideas, but what can I do to implement into my team?
Yeah, so I think the biggest mistake is in not owning the stresses and strains that are in the workplace. I think that empathy is absolutely essential. And I think to be able to have that empathy and communicate it to your workforce, you have to acknowledge what's going on.
Absolutely.
You have to acknowledge and start having the conversations that we can see that you're in a stressful environment. And we can see that actually, if anything, those stresses are building more and more at the moment. How is that affecting you? How are you doing with it? Having that empathy and opening up those conversations is absolutely essential. And I think often employers are well-meaning, but they stay quiet because they're worried about saying the wrong thing.
I get it, because even now I'm saying things, I'm trying to back cover myself, because I don't want to offend anybody, or because we're all trying, but it is. I think especially in this day and age where we are in, people are fearful of saying anything to open up any can of worms that they don't. That maybe they'll get it wrong, but their intention's not that. They haven't got any malice intent, but sometimes their wording maybe off topic or maybe off key, and I understand that. I think that's absolutely something to note as well. I think it's really important you said that, actually.
Yeah, and I think that there's a lot nowadays that people are worried about offending someone, and it stops them speaking. And
absolutely
it's that silence that is worse than that offence. If someone's offended, then they're offended. The perpetrator may apologise, they may have a conversation, there will be learning, and they will move on. People move on.
Amazing, really, isn't it? I know. When you stop thinking, people move on. You're not going to worry about it. No, exactly.
And with mental health, there's no blanket approach, and I love that, because I have to work hard as a nurse to understand what works and how to help someone. And in that process, even as a registered professional and a specialist in mental health, I offend people. I make mistakes. I say the wrong things. I say things that can trigger them. But in that process, I build a rapport with them. I repair it. I apologise. I don't do it again. And I now know what works and does not work for that individual. I can then share that with my team so that they don't make the same mistakes. And we snowball. And that care just gets better and better and more individualised. And I think putting some thought into the culture of the workplace as well. Making sure that there's no blame culture, for instance. Make it okay for people to own their mistakes. If we're punishing them for everything that they do, they're not going to be so forthcoming when they make a mistake. So I think having that openness with people and that compassion and leading from the front, having that humility to admit that you make mistakes at every level. There are mistakes, and that's good, because even in a perfect world, there will be mistakes, because that's how we learn, that's how we grow, that's how we move forward as an organisation. And let's do that together. So it might be that there's a newsletter in your organisation. It might be that part of that newsletter is to share some learning. And then they can see that actually something happened over there and nothing terrible happened to that clinician. But as an organisation, we learned from it, and now we know look out for this because that happens.
Yeah. I do you know what? It's those things that... So we do a newsletter here for Hoop Healthcare. I think, we do work across the other business lines. But it's funny you said that, because I wouldn't have necessarily associated that with promoting wellbeing and supporting wellbeing.
No.
And I wouldn't
but
have...
also, you wouldn't want to offend that nurse, would you? You wouldn't want to embarrass them.
No.
But if it's done in the right way,
absolutely,
you don't have to name names.
And we haven't, we don't, and that's the thing. But you wouldn't have thought that. And so that, it's the learning, it's supporting them, giving ammunition to, and that armour, as we talked about before, it's giving them armour to deal with these things, and if somebody has made a mistake, then as you say, you learn from it. And I'm thinking now of examples of things, and you do, and I sometimes have to give nurses, updates if errors have been made, part of my role. And I always start it with, there is no judgment here because I've made mistakes in my career. And that is how, because I never want anyone to think that they, anyone is on this pedestal.
Yeah.
Perfection does not exist. I feel like that is my new mantra.
Mm-hmm.
Evolution, not perfection. That's what I want. I want evolution. I don't want perfection. Because you're benchmarking yourself against something that doesn't exist.
Yes.
So how unhealthy is that for a start?
Yeah.
It's you off to off on a bad foot there. Is there anything else then in particular? Because again, you and I can talk about this, and I keep on. It's just such a huge topic, isn't it? But any practical things? So we've got the newsletters, we've got maybe resilience training as well, opening that dialogue, chatting and talking with your team, the culture. Is there anything else that you would think, maybe any courses in particular?
Yeah. So there's definitely more than just the one I have left. So I'm going to push the boundaries a little bit.
No, that's fine.
So I'd say that we're in a situation where we're all busy. There is little time, as much as I will playfully argue that we make time for what's important. Mm-hmm. There is limited time, limited resources. So I would say make every interaction count. Mm-hmm. Make it count. Think about how you're opening those conversations. Ask open questions. Invite someone to have a chat while you're waiting for the kettle to boil. Make the most out of every interaction that you have with people to show them that compassion, show them that you do care. I think that's just so important. And
you find as well that on those informal catch-ups and chats, actually you get a lot more from them, don't you? Because they're
relax.
Already at ease. Absolutely, that's the word, relax. And that's people then will naturally talk.
Definitely, and I think having a good wellbeing policy as well, and flaunting it, be proud of it, make it a policy that you're proud of. Mm-hmm. Show your workforce how you are going to support their people. And that's something that I can offer as well, is that consultancy and that little bit of helping hand to do that in a very collaborative way. And also putting on training sessions. And if you're not having training specifically around mental health and well-being, catch people in the breaks, ask them how they're doing, ask them if they need anything. Again, just take that opportunity to check in with people when you've got them there, when you can see they've got 5 minutes.
I think that's really important, Jen. I think that's also as well, you can implement that now.
Yeah.
You don't have to wait for anything. I think, I think anyone listening, you're going to be trying to relate it to your own experiences. Excuse me. And I think that, I think that's really, really key to anything, isn't it? It's just starting that now. And then I think the consultancy piece with the package and how you design that is going to look very different for each company and every organisation, depending on which area and sector you work in. Yeah. But I think, just really, really interesting, Jen. And I think we actually come to the end of our allotted time. I'm very mindful. Oh my goodness, we are way beyond. I've just looked now. I'm sure everyone's tummies are rumbling. But honestly, I can't thank you enough for being here today. Honestly, I feel that was so beneficial. Not just to anyone in healthcare, but anyone in surrounding sectors as well, education, even those that maybe aren't in work at the moment, there's going to be a lot they can take from that. So honestly, thank you so much for, your input here. I think it's been totally invaluable, and thank you so much for your time.
Oh,
really
thanks
appreciate
for having
it.
Me.
No
it's been
problem.
A pleasure.
Thank you so much. And that brings us to our end of our podcast series. I'd like to thank everybody who has taken the time to give us their insight into healthcare, what it means to work in this sector, but also as well, I hope people have taken away a few pointers on how they can look after themselves a little bit better and actually how we can look after each other a bit better as well. So from all of us here at Hoop Healthcare and Hoop Nursing, thank you so much. Take care.